Hi everybody, Dr. Candice here with your word in the clinic for this week. So the word in the clinic today is breastfeeding, okay? Hopefully I won't lose my audience because I know some of you are not breastfeeding, but you may know someone who is and can share these wonderful tips with them. So just listen and you may be able to help some people out, okay? All right, so this past week was National Breastfeeding Week. And then also this month is National Breastfeeding Month. So that's why I'm trying to stay on trend and follow our health news. So we definitely want to talk about this. So first, I want to give a big hand clap to all the moms who breastfeed, okay? And then for those moms who are expecting babies and they're considering breastfeeding, I definitely want to encourage you to do that. Now, for moms who decide not to, who don't want to, have no interest, that's okay. I'm not judging or shaming, okay? It's okay. But this is a time that we want to encourage mothers to breastfeed, and we want to say awesome job to those who do, okay? So I have some tips for new moms to make breastfeeding more successful, because I oftentimes see babies at the age of 3 to 5 days of life, and if it's especially a new mom, that's one of their big concerns, that if they're getting it right or they may have some problems with breastfeeding. And I do help patients with that quite often, new moms. So just wanted to bring that up. Also, I want to, like I said, encourage more moms to breastfeed, and I'll tell you why. So why should we be breastfeeding? All week on my social media, I've shared some posts on the benefits of breastfeeding. So if you follow me, you've probably seen them, and if you haven't, let's go over them. So just a few of those benefits are because the breast milk is full of the right balance of nutrients. You know, when we make formula, we're trying to get it right, everything that the baby needs. But breast milk is already perfect. They call it liquid gold, right? It's easier to digest. You will not have any problems usually with any types of constipation if you're breastfeeding your baby, which is a common complaint with formulas and reason to change formula. So it just kind of stops all of that stuff from happening. Hi, Jessica. Hi, Harvey. Hi, Regina. Thanks for watching. It also, the big one is the breast milk passes on antibodies that boost your baby's immune system. It's also wonderful for baby and mom to bond and secure their attachment. And for moms, you have some benefits. It can help you lose weight. I know it helped me tremendously. I felt like I didn't do anything and I lost all this baby weight. It was the breastfeeding. And it can help you with your mood. It has been shown to reduce or help with postpartum depression. So breastfeeding is not easy. That's the first thing I'm saying. I'm going to be real with you. I did it with 2 kids. And it was one of the toughest things I ever did. It's not easy. It's challenging. It's time consuming. You're like, oh, why am I doing all of this? You're questioning it. But it's worth it for those reasons I just mentioned. And it's awesome. And it's worth it for you and the baby, not just the baby. Okay? So we're going to move on and give you those tips to help your breastfeeding experience to be more successful for our new moms. And also to kind of ease some of that anxiety for moms who might be thinking, should I not? I just want to help you go, okay, let me try it. Just why not? All right. So the first tip is to plan beforehand. While you're pregnant, you're planning everything, right? So one of those things, let it be breastfeeding. Think about breastfeeding. So you're planning for this baby. You're probably getting some baby books, some parenting books. You may be super awesome and take a parenting class. You're thinking about sleep and, all these things that's about to happen with this new baby. So educating yourself empowers you to be able to handle problems when they come up, and you don't have to be reactionary like, oh, I got a problem. What do I do now? You're most likely to be ready when you're prepared and you educate yourself. So do that with breastfeeding, okay? Also, it helps to correct myths and misinformation that people are putting out there about breastfeeding. So let's go over a couple of those. Breastfeeding hurts. Yeah, it can if you're not latching properly, if you're not taking care of the nipples, and we're going to talk about that. So it can be a little uncomfortable. But if you're doing things right, it should not be painful. Might be a little uncomfortable in the beginning, the first couple of weeks till you get used to it, but it should not be painful. People with small breasts can best breastfeed. I'm living proof of that. I'm part of the itty bitty titty committee, okay? And I breastfed and I had plenty of milk. So that's a myth. If you've had breast surgery, reduction, or let's say you enhanced a little bit, you probably still can breastfeed, okay? Also, sag. A lot of people, I hear a lot of, I don't want to breastfeed because I don't want my breast to sag. Well, let me tell you, as you get older, it happens anyway, whether you breastfeed or not. And then also, when you're pregnant, you might notice that things get big. Hi, Dr. Terry. Hi, Auntie Maxine. She's on every week. She's supporting me. Awesome. Hey, everybody. Hope everything's well if I missed anyone. But we were talking about the myth of that breastfeeding causes your breast to sag. And I said, as you get older, they sag anyway, right? You have these ligaments and they just start getting tired of holding things up. But as you're pregnant, things get big. Your nose, your ankles, things swell, you grow in size. Your breasts grow. So even just doing that through that pregnancy period can cause some sagging of the breast too, even after, a year or so later. So it's just not breastfeeding that causes sagging. There are other things too. So we can't blame it all on breastfeeding. That's a myth, all right? So those are just some things I hope I could clear up so you might go to the other side and decide to breastfeed. So we also talked about when you prepare and educate yourself on breastfeeding, you will already kind of know about positioning, latching, signs of hunger, the different type of pumps that are out there, what you want, and how to store the breast milk properly. So definitely while you're pregnant, learn all of that stuff. It sets your mind at ease. You won't be so anxious and frustrated when you start the process. Number 2, let your doctor, the hospital, the nurses, everybody know I'm breastfeeding. So that as soon as the baby is born, within the first hour, if you're okay, they should be bringing the baby to you to latch on and breastfeed. And just because you read everything and you're an expert, there's nothing like doing it. It still may be a little difficult, right? So ask for help. Have the nurse help you. And you can even ask for a lactation specialist. Definitely have them to consult lactation. That's one of my next points, okay? Doing it and knowing are two different things. So ask them to help you and make sure they get the baby on your breast within the first hour as long as you're okay. Okay, that's important. Number 3, have the lactation specialist to come. Absolutely. Work with them the whole time you're there, not just that one visit. Keep asking them to come back to check on you. Have them to teach you all of the tricks of their trade, proper latching, making sure your positioning is good, some different options of positioning. Have them to teach you about storing breast milk, about the pump. You're using the pump and you know what to do. You want to leave that hospital totally comfortable with this whole breastfeeding thing, and you have the best person, the lactation specialist, there to help you utilize them. Okay, they can do all of that for you and send you with some information as well, and even websites. Also get their number. Most of them are willing to talk to you even after you go home if you hit some rough patches. Okay. Our 4th tip is knowing the concept of supply and demand, okay? Supply and demand. This is not economics, this is breast milk. So something has to go on every 2 hours. That's my thinking. The baby gets to feed on demand when they want to, when they show you signs of hunger. But in order to get your breast milk supply in, you've got to demand it, okay? So you can pump every 2 hours or the baby can feed every 2 hours. However you want to do it, but you need to demand of the breast to make that milk. If you go 4, 6, 8 hours and nothing's happened, you're not going to have a good breast milk supply. So supply and demand, remember that. The baby can feed every 2 hours on your breast. You want to alternate. And you can do one if the baby prefers one side, and then you can pump the other one. You can get creative, but you have to demand it of the breast through sucking or pumping in order for that milk supply to come in, okay? Now, don't expect a whole lot of milk within the first few days or even the first few weeks for some people. Initially, you just have little bits of colostrum, okay? And that's what the baby needs. And then over time, it comes in. But work the process and you will reap the rewards. That's a lot of RR, right? Okay, number 5. This is a big one that I found very helpful. Have your baby to sleep in the room with you. not in the bed with you. I didn't say in the bed, okay? In the room with you. Have a portable bassinet or a second crib in the room with you. That has been shown the first year of life to be very successful in preventing SIDS and also helping breastfeeding moms. In general, helping you with getting more sleep. Push it right up to the side of your bed, that crib or bassinet, and you can reach right over and grab the baby and do what you need to do and put them right back. You don't have to get up, go to another room, and all of these things. So it really is helpful with breastfeeding. It really helped me during those really sleepy nights, and even my husband, because he did a lot of the nights as well. So definitely have them in the room with you, not in the bed with you, okay? It makes it much easier. I have 2 more tips. The 6th tip is pacifiers. So you don't want to introduce a pacifier necessarily until your breastfeeding is well established, okay? Because people call it nipple confusion. I didn't have that problem. I used the pacifier right away, but I have had people to have that problem. So make sure that breastfeeding is going very well. Hi, Pastor Davison. Thanks for watching. Make sure it's going very well before you introduce that pacifier. Pacifiers are of benefit. I'm not against them, but you just don't want to interrupt your breastfeeding until it's well established. Number 7, nipple care. So yes, we're talking about your breast, the nipples of your breast. You need to take good care of them. That's when people start thinking it's painful. Make sure that after the baby feeds, you wipe them off. You're using gentle cleansers. Make sure to apply some lanolin over your nipples to make sure they don't become cracked and dry. That's painful, okay? So take good care of your nipples. Take a look at them. Make sure they're not cracked or bleeding. You'll feel it. That is key also for you to have great latching and for this not to be a painful process. And my last tip is you've got this. Hang in there. It can be frustrating. There can be some bumps in the road. Keep that lactation number to call them for advice. Keep going with it. Read, educate yourself. Don't give up. The recommended period of breastfeeding is 6 months, and I'm going to be honest with you guys, I barely made it. I made it the 6th month with my kids. The first one was Tara because I was in residency and I couldn't pump every 2 hours, so my supply went down. Hang in there. Don't give up, okay? So if you can make it 6 months, that's great. And we do even recommend up to a year, and therefore your baby will never have to have any formula, okay? So if you can go a year, you're awesome. But if you can make it 6 months, you've benefited the baby greatly. So hang in there. Don't give up. Hopefully this was helpful for you guys. Have a great day. We'll talk to you next week with the next word in the clinic. And that's all I have. Thank you for listening. Bye.